Dr. Tyler Hughes has given his time, energy, and heart to the practice of rural surgery. While he initially established a successful career as a surgeon in Dallas, he eventually chose to fulfill his dream of practicing in a rural setting. Dr. Hughes recalls that he knew instantly that McPherson, Kansas was the place for he and his family to establish long-term roots. For the past 16 years, Dr. Hughes has mentored and shared his philosophy that it is a privilege to care for patients, especially in a small community. Initially, when he moved to rural Kansas, there were no medical students to mentor. So Dr. Hughes personally sponsored college students to shadow him at his own expense, confident that some may be inspired to become surgeons and join a meaningful profession. Many of those students have gone on to be successful physicians. Dr. Hughes established the Rural Community page for the ACS portal. The portal is a tool used by rural surgeons worldwide to access clinical calculators, educational videos, and a question and answer board for help with difficult cases. The portal serves as a professional discussion board, an avenue for isolated surgeons to connect with friends and colleagues. In 2010, Dr. Hughes was appointed by the ACS as Governor-at-Large for Kansas. This post has provided wider exposure to rural health issues. In 2011, he was the second rural surgeon in history to be appointed as Director for the American Board of Surgery. Tyler Hughes strives to ensure that the best quality care is provided to his rural patients. Over the years, he has become one of the most influential advocates for rural surgery throughout the country.
17 years ago, almost to the day, I gave up life in the big city to be a country doctor. Ever since, my life has been an adventure of ambulance rides, fabulous medical students, and challenges that have made me a better doctor and a better person. Let me tell you, you know you're a rural surgeon when you find yourself in a hazmat suit with two fire hoses pointed at you while contemplating a field amputation to extract a man from an overturned tanker truck. It is an interesting life. But no one achieves a goal by themselves. When Neil Armstrong stepped on the moon, it happened not just because he was a very good pilot, but because of the dreams and hard work of an entire nation. For me, this award is my moon landing, and it is the result of the efforts of thousands of people as well. Starting with my parents, Cleland and Jerry Hughes, who raised me to think in terms of service and excellence. My wife, Mary, who for 34 years has been my equal partner in caring for my family. My children, Dorothy and Tyler Jr., who inspire me to be the person they think I am. I must mention four very important surgeons. Dr. Dean Kipp, a plastic surgeon who repaired my cleft palate, giving me an understandable voice. David K. Selby, who took a naive college student under his wing to teach me what being a surgeon was about. Ernest Polis, the man who trained me as a surgeon and gave me a philosophy of what it means to be a surgeon. And Clayton Fetch, partner extraordinaire, who is always there for me. There are administrators like Stan Regier and Rob Monacle, who understand the crucial role general surgery plays in rural medicine. I must mention anesthetists like Mark Williamson, nurses like Heidi Cheney, and dozens of aides and nurses who care very intensely for their patients, keeping them and me from harm. The maintenance guys like Pat Fowler and James Wilson, who make the wheels turn in the background so that I have a safe place to operate. And I have to mention Dr. John Warden, pharmacist, who advises me on patient care every day and provides emotional and intellectual support. The American College of Surgeons and their leadership. But most importantly, it is a community, McPherson, Kansas, which is a place that fosters excellence and supports quality health care. This award really is for them. I'm just climbing down the ladder. They made it possible. Thank you from the bottom of my heart.